Hi everyone, thanks for tuning in to Mental Health First Aid. I am Michelle Nunes. I am presenting for tax and trust professionals and for Accounting for Good. Many of us are aware of mental health problems around us at the moment. There are clients suffering that I'm aware of, there are employees suffering, there's friends and family. So this is a very valid topic, and I'm hoping that this information that I'm sharing today will benefit you and encourage you to offer assistance that's helpful to others. This is an educational webinar. There's no substitute for doing a mental health first aid course yourself, and I will be encouraging you to do that and providing resources at the end of the webinar. So the start of the thought of the day: anxious thoughts weigh down the heart, but a kind word cheers it up. So if you remember nothing else, that is it. I want to encourage you to spend time with people and be listening to them and giving them helpful advice where appropriate. And I'm going to go through some tips on how to do that well. This is the outline of the webinar today, and we're going to specifically work with depression, anxiety, psychosis, drugs, alcohol and gambling, suicide support, and then some next steps for your own well-being. The definition of a mental health first aider is very useful. This one makes three important distinctions. Firstly, a mental health first aider has planned a response. In other words, they've taken some training, they've become skilled, they've become thoughtful about their desire to help others. They've made a deliberate attempt to get to know things that are being offered in New Zealand and resources to help others. A mental health person, secondly, has compassion. You have to have a heart to stop what you're doing and your own priorities long enough to see and observe somebody who's in pain and then to offer some emotional support to them. And lastly, a mental health person will be noticing others and drawing on their observation of that person to walk towards somebody who's in pain rather than cross the road and walk away. So put really simply, a mental health person is a person who's planning to help others. 1 in 5 people in New Zealand are going to be suffering with mental health this year. With wars and pandemics, it might be even higher. I'm aware of my own struggles. I'm aware of my family. I'm aware of others. I believe there's great benefits to have a strong mental health in yourself and in others. Obviously, you will be able to focus on reducing stress and improving communication if you are strong mentally. ALGAE is a method of helping others. It's a mental health first aid action plan that's easy to remember when faced with a situation. A stands for action 1, which is approaching the person after you've noticed a change in their behavior or in how they are and offering assistance. Firstly, you have to work out if it's a critical assistance or crisis mode, like they're seriously wanting to harm somebody or harm themselves. And if that's the case, then you apply obviously the suicide prevention measures. But if there's no concern that it's a crisis, but you know that they're not well, then it's just simply a matter of asking how they are feeling and how long they've been feeling that way, and then moving towards action 2. But to do that well, you really have to approach the person and arrange a time to talk with them, which is going to be private, non-confrontational, and where they'll be comfortable and relaxed. And so sometimes you might say, hey, let's grab a coffee. I notice you're not feeling really well, and I wonder if you'd like to talk to me about it. Something like that, something casual, and trying to find that time that you can sit and talk to them. So the action 2 is listening and communicating with the person. When listening, it's hard to do, but what you need to do is take away your judgments and avoid expressing any to that person. So when somebody's emotionally distressed, they just want to be heard, and your listening will help. Make it easy for the other person to feel like they can talk freely about what's happening for them, and that you hear them and that you understood. And that might take a while. Allow them to do all that talking. And if somebody has nothing further to add, and you feel like they've expressed everything that's on their heart, then possibly you can offer some support and some information. It might be just offering further emotional support. It might be physical, such as helping them with a task that's overwhelming, or even going to the boss and explaining how that person is, not feeling well and needs a reduction in workload, or perhaps suggesting that they talk about it with a family and friend. Action 4 is encouraging the person to get professional help, and it might be directing them to websites, helplines, counsellors, doctors, depending upon their need, and we'll go into more detail of that later. And finally, is encouraging other supports, and those other supports could be supports that you're aware of that they're not aware of. I know my own church offers a program for the last 14 years called Celebrate Recovery, and that's focused on helping people get through domestic violence and other addictions. And it offers that peer-to-peer support. I really believe it takes a village to heal a person, and so I think it's very hard to do mental health work by yourself. Let's start with depression. So about 12% in New Zealand meet the diagnostic criteria for a mood disorder, and depression is often linked to other problems. Half the people diagnosed with depression have had their first episode before the age of 32. So negative emotions are normal, but a depressive person is somebody who's got those negative emotions and they can't do their normal day-to-day activities. It's a lot harder for them. Symptoms of depression affect our thinking, our feeling, our behavior, and our physical well-being. So here are some signs of depression. A person usually looks sad or low and feels anxious, irritable, easily can cry. They may be lacking their normal interest in personal hygiene and grooming. A person with mild depression can hide it from others, but if the depression is severe, it's more noticeable. It's easy for a friend or a family member to judge someone who's going through depression as being lazy or self-centered or not helping others or not pulling their weight, having a poor work ethic or being incompetent. These attitudes are unhelpful, and they do reinforce to the person who's suffering that they are unworthy. So it is important to understand if a person is depressed and to talk about it with them. Here is some help available in New Zealand with helplines and websites that have got more information on how to get through depression. Now, everybody experiences anxiety from time to time. People may describe anxious feelings with terms like I'm feeling stressed or overwhelmed or worried. And those feelings are kind of normal. But it's helpful to distinguish what normal anxiety is and what abnormal anxiety is. So mild uneasiness will actually help us do better. So if you're anxious about an exam, then you're going to work harder for it. If you're anxious about a work deadline, then you're going to prepare better for it. Anxiety helps you avoid dangerous places, avoid dangerous people. It motivates us to solve everyday problems. But where it becomes further is when it's affecting our daily lives. So if you are worrying a lot about past or future events and your mind's actually racing from one worry to another, it's going blank, it's hard to make decisions, you experience a lot of confusion, you just know you're not yourself, and you're having panic attacks perhaps, where you've got a pounding head and chest pain. Perhaps you're avoiding social situations and you're starting to change your behavior to what you normally would feel comfortable to. or your feelings are like way overrated or over excessive fear. You're feeling very irritable, very angry or confused. Those are showing that anxiety is starting to affect you. And that means that you need to reach out and get some help, or you may be in a position to actually help somebody else. So if you notice that somebody is not looking well or not feeling good, then the best thing for you to do is doing the algae again. And so some tips for some non-judgmental listening. Firstly, listen carefully to what they are saying. Continue to not give negative judgments about their character or their situation. Be aware of your own body language and about what posture you're giving and what eye contact. You're not rolling your eyes, but you're asking clarifying questions and open questions. Allow silences and be patient with the person who is anxious. Don't interrupt, and only use minimal prompts such as I see. And then it's important not to give flippant advice such as pull yourself together and you'll be fine. But it's a good time if the person's really anxious to give them appropriate support to help them overcome what they're going through, and treating the person with respect is obviously part of that. Anxiety.org.nz, the website, is available for those that need help with this, or their phone number is here for an anxiety helpline with trained counsellors ready to talk at any time. So psychosis is less common than other mental health challenges, but it still affects about 1% of the adult population in New Zealand every year. And there's usually a gradual increase from psychosis from where at the at-risk stage to an acute stage. And so I just want to go through that a little bit. So firstly, a person becomes unwell. And this is when you may notice some changes in their emotions, their motivation, their thinking. They're starting to say strange things. It doesn't, it just appears, it's not all the time. It just sort of, you're noticing they're not their usual self. Then there's a becoming unwell phase. That's where they have definitely changed. And you notice that behavior that you notice sometimes has become more regular. So their emotions and motivation and thinking and perceptions and their behavior have all changed markedly from what they used to have before. Then it becomes acute. So when it's at the acute phase, that person is experiencing symptoms such as delusions and hallucinations, and they have very disorganized thinking, and it's very difficult for them to work. They can't maintain their relationships. They can't study if they're students. And then there's a recovery stage where people go through to maintain a level of well-being. So they get some help and they start recovering and they become a little bit more settled and normal. And then there's a relapse. And quite often with people with psychosis may relapse just once, or it may become a regular pattern depending upon the medication they are on and that they are taking for their help and the recovery support that they're getting through their help. So that's a little bit about the signs and symptoms of psychosis. So just to let you know that people do recover fully. Some people definitely do recover. Not everybody that goes into psychosis stays there and stays their life like that. So I want to give you that hope. If you know somebody going through it, medication is really important. Health checks, psychoeducation, cognitive behavior therapy, and community treatment. As I say, it takes a village to help heal a person. So there are some websites that might help you find help for somebody who is going through psychosis. And it's really helpful for family as well who might be helping a person. Problematic substance abuse. So this is the use of alcohol or drugs, which is significant enough to be having problems that are ongoing. So there needs to be a few things, such as the substance taken in larger amounts or for longer period than the person originally intended. The person may want to cut down but is finding it difficult to do so. A lot of time is spent taking drugs or using alcohol or recovering from its effects. And the person with abusive problems have a strong urge for it daily. repeated use despite the fact that it's causing problems all over their life. Other important activities are neglected because they are abusing themselves with drugs or alcohol, such as work. The use continues despite massive mental and even health problems being caused, relationship problems. And then when there are symptoms of withdrawal that are experienced when a person tries to go away from it. So it's pretty rough. So people experiencing problematic abuse may not be ready to change. And if you're a person helping somebody going through this, it's really important that you understand what you can do to not help them get worse or enable them to continue in the addiction. So, I'm asking you to suggest you learn a lot about it, even if you're not the person going through it. There are 6 stages of change, and the information and support you offer will depend upon where the person's at in their stage of recovery. So I've labeled the 6 there. So the first one is obviously when the person themselves don't think they have a problem. So that help, you can only give information about how it's affecting you and share your own feelings. Discuss less harmful ways of perhaps using the substance. The second one is contemplation, where the person is actually thinking that they may have a problem, but they're not sure. And if you're helping a person in that stage, then you can give them more information about how it might be affecting them as well as how it's affecting you. And then recognizing an overdose and not enabling that behavior. Preparation is when the person's actually decided to make a change. So that's a significant step. You're just going to encourage that person. You're going to support their decision to change and help them make a plan, like seeing a counsellor, going into a recovery group. Action is similar, they actually make a change, actually go into the help with that helping person. They keep the appointment they've made, they develop strategies to say no, they avoid situations and friends that will help them get out of that trap, and they have regular health checks. And the maintenance is just keeping up with those new patterns, and it's not easy. Support person will help them keep their new behavior up and focus on all the positive effects of the journey they've gone through. And it will be a journey, and it will take several years often. So the lapsing, kind of, you can expect this to happen. It's predictable, and that's part of building new habits. Everybody who wants to get fit lapses and doesn't keep up with their new routines. We're all human, we all make mistakes, and so it's just a matter of restarting that habit of good, staying away from the alcohol, staying away from the drugs again. And you can expect lapses to sometimes be several times before they're able to particularly make a significant change to their substance use. Unfortunately, in my career, I've seen multiple instances of profitable businesses being destroyed by gambling addiction. When a client has a business, he or she can withdraw large amounts out of the business, and the family doesn't see it immediately. The accountant does, though. Drawings will go up, and very quickly I find that tax debt mounts and the business owner cannot repay. There's creditor pressure, and eventually there's a breakdown. But it can take months, and I've seen it take years to happen. And the person just gets further and further, and it spirals deeper and deeper. So I've suggested here some of the effects of gambling and some of the behaviours of gambling, including, for an accountant, overdue taxes is the first thing, overdue payments to you as an accountant, missed appointments. Client doesn't turn up at appointments or misses them completely. Their mind's not in the right place. Unfortunately, early intervention with gambling is really important, because there's a higher risk of suicide with gambling than like with anxiety or with depression. and gambling and depression can go together, gambling and anxiety can go together, but gambling is a strong association of suicidal thoughts. It's like gambling's like a hidden thing, I guess, and people are afraid of confronting their behavior and talking about it with loved ones. And so that they kind of opt out of doing that by committing suicide. So it's really important to intervene. But when you can ask a person about it, when you stop to help them or try and help them, you've got to be prepared for the full range of responses that you might encounter, including denial, relief. It could be either of those or anything in between. They may rationalize, they may lie about it, they may minimize it. I wish I could say that I've seen clients recover and put their businesses back into the black, but unfortunately, up until now, that hasn't been my experience. I've not seen it. It's like a big dark hole. And I've only assisted loved ones who are faced with having to recognize that problem and close their businesses down. I've often had to walk away, and that's been really sad. So anyone affected by gambling, including family and friends, can reach out for help. It doesn't have to be the person that is going through the gambling help. They don't have to be at that stage that they recognize their help. But if you've got a loved one or a family or friend who is gambling seriously, you can reach out and get some helps and some tips, including, not ever lending money to gamblers. And for those that have businesses, they just can't manage a business when they have a gambling habit. So I do want to mention suicide, because we have a very high rate of suicide in other countries in Aotearoa. I am aware of an accountant who lost 5 clients to suicide in 1 year. My young daughter, when she was a school age of 15, attended 2 funerals, including one boy who'd been sitting next to her in one of her classes. So suicide is around us. The main reason that people give for attempting suicide is the need to escape from unmanageable emotions and thoughts. They have unbearable pain. They feel their situation is hopeless. They feel alone, worthless. They sincerely believe that the world and other people around them would be better off without them. They're wrong, of course, but they're so deep in it they can't see it themselves. Or secondly, sometimes the desire to communicate a message to somebody else, and they may commit suicide but not the intention of actually achieving it. They really just want to get help. So the first one is the most important one to be aware of. And if you see somebody with any of these signs, and with suicide, there might not be signs. There are athletes that commit suicide, and there was one at the Olympic Games that just had no signs of it beforehand. But if you see somebody with any of these signs, then please do approach them for a conversation using the algae method, telling the person that you want to care, that you want to help, expressing empathy, asking directly if they've had suicide thoughts. Don't avoid this question, because it's important as part of the assessment process of people that you're helping. Allow the person you're helping to do most of the talking, thinking and feeling, and reassure that you are listening. Remember at the end to share, to thank the person for sharing their feelings with you, and acknowledge the courage that it takes to share feelings. Finally, you. So if you're a mental health first aider, you need to remember that the healthy mind takes time to foster, and you need to keep really aware of your own mental health as you're helping others, as you're part of a team of other people. And so these are, I just love this platter, this idea that every day we need some physical time, some downtime, some chilling out, some play time, some sleep time, focusing time, and obviously connecting time. And sometimes these things we can do together. For example, playing with your children outside on a swing may give you connection time and also some play time. So, I'm planning this afternoon to go for a walk, but I'm bringing my daughter at the same time because we'll have a chat and a catch up. So what are you doing to support yourself and also to support your own team's well-being? Is there more you can do? Is there something you can start doing? So I do recommend that you keep your team focused in with some regular check-ins and understand their well-being needs. So if you want to do a team reflection survey, then email me and I'll send that out to you. We have a template for that, and it's quite a helpful way of getting from everybody how they're feeling about things. Make sure that they're in the right mind to be productive for you. So before we go, I thought I'll share this quote for you. It's really good to know some mental health first aid. For this material, this webinar, I've drawn heavily upon the Mental Health First Aid Manual published by Te Pure. I want to encourage you to search online for mental health first aid courses. There's online courses run by St. John for $249, which you can enroll and get your own certification on it. And I do encourage you to do this. Thanks for listening. If you've got any feedback, I'd really welcome that. So you can email me or make a mention on Facebook. I appreciate that your time's precious, and I hope I've given you some ideas to ponder and some next steps to help those around you that you love. Thanks again. Bye.